Hi everyone, hi. Hope you're all doing well. Hello to the people joining. Hope you guys are all well. I'm back like I promised earlier. We're going to do the remainder of what we started earlier today. We're going to do some science revision. We started on the heart earlier. I don't know if you guys remember what we were doing. We looked at the right atrium, right ventricle, left ventricle, and so on. And the timetable will be released later today, don't worry. We looked at all of that, and we looked at the pathway of blood through the heart. Hi, ARU. Hi. Welcome to everyone. Welcome to the new people and to the regulars. Nice to see some regular people here. For those of you who are sitting there listening to me chat away, make sure you do like the live so that other people can join so they know that we're revising. We're going to finish off what we started earlier. We talked about pacemaker cells and so on. Welcome to everyone. Welcome to all of you. Make sure you like the live. Make sure you're following as well so that other people can join us in our revision. Thanks for the follows. Thanks for the likes. Hopefully we're all doing well. Like I said, we are going to continue with our biology revision from earlier. Biology, and we started looking at the heart earlier. So we're going to continue looking at the heart. For those of you who were there earlier, what's this? My teacher said it's not allowed to put swim. I'm not sure what you're saying, Bobby. The bit that we did earlier, the part 1, which was looking at all the parts of the heart, looking at the pacemaker cells, looking at the pathway of blood through the heart, the deoxygenated part, the oxygenated part, all of that's going to be on my YouTube as well. So you guys will see all of that there. And then this will be the part 2 to that. So this will be the continuation, looking at coronary arteries disease, CHD, coronary heart disease, and what that can cause as well, and then the treatments of it too. All right. So we're going to be trying to do these lives every day-ish, whenever kind of I can around my work, as well as around your guys' school schedule. And on the weekends, we'll try to do them twice a day at least. Brent, any tips for coping with exam stress? Yeah, try not to stress yourself out too much with revision, okay? Only do short spells of revision and make sure you're rewarding yourself after them. So maybe do an hour of revision, then spend an hour or two doing something you enjoy doing. Take your mind off the exams and don't just think about them constantly, because you've worked hard, okay? This is all kind of the ultimate ending to your GCSE journey. So it's not like you've only practiced for 2 weeks. You've been working hard for everything for years now. So this is all putting everything into practice for you, okay? Yeah, I'll do some lives on English and advice generally for you guys as well. But yeah, let's get started with this stuff here so that we can quickly cover it. I've been revising 40 hours a week. That's crazy. Some people can hack that. Not everyone can. So if you can, kudos to you, but not everyone can do that. The pacemaker, the natural pacemaker cells in the heart control the regularity of the heart rhythm. So they help to make sure that the heart beats in a regular rhythm. So it helps to solve things like arrhythmia, okay, which is where the heart beats irregularly. And also it helps to kickstart the heart if it was to pause, okay? For those of you who are here for the very first time, I'm going to mention this once. Make sure you check out my predicted papers on my website, GCSE maths and science predicted papers on christuition.myshopify.com. Okay, if you check these papers out, you'll see that there's AQA, OCR, and Edexcel maths papers, as well as AQA combined and triple science papers on my website, and they're predicted for this year's exam period. So they're going to be the best source of revision for your exam now. They're as close as you're going to get to the real thing. And if you go onto my website, again, that's the website, and you use the code LIVE30, don't forget to use this code, it will get you 30% off all the papers which are already heavily discounted. So they'll come down to about 60 ish p per paper. So really good opportunity for all of you guys. And like I said, I've told you guys this before, 20 to 24 hours per paper doing research on what's going to be coming up, as well as putting those papers together and their mark schemes. So it's really, really the best thing you're going to get for your revision. So make sure you do that. Anyway, let's continue with the heart. Also, in addition to earlier, check out my YouTube, because this is where I've posted, I'm going to post the part 1 of this live. So we did the part 1 earlier. This is now part 2, isn't it? So if you check out my YouTube, Tutor Chris, spelt like that, if you go on there, you'll find all the lives that we've done so far. They're all going to be posted here, including the live that we're about to do now, finishing off the heart, okay? GCSE heart. So we should know that heart cells are made up of cardiac muscle, okay? Cardiac muscle. And this is a type of cell which contracts continuously. Okay, we should know that this cardiac muscle is supplied with oxygenated blood. Can anyone tell me what supplies the cardiac muscle with oxygenated blood? What supplies the cardiac muscle with oxygenated blood? Which blood vessels do that? It is the coronary arteries, okay? It's the coronary arteries. The reason why it's the coronary arteries is because the coronary arteries have their own, the coronary arteries are the heart's very own VIP supply of oxygenated blood. Okay, the heart needs to be pumping 24/7, non-stop. So it needs oxygenated blood 24/7, providing oxygen to the cardiac muscle for respiration to help the heart beat 24/7, okay? So that's why this happens. Now, sometimes what happens is due to genetics, due to poor diet, and due to high cholesterol intake, these coronary arteries can begin to get blocked. I've been on live earlier today. You just missed it, but don't worry. The lives that I'm doing are going on my YouTube, so you'll notice it. All of them will be uploaded up there as well, okay? So imagine this is how a coronary artery looks, right? There's the coronary artery. You can see there's the lumen, and the blood passes through these coronary arteries going towards the heart. Now, if we have coronary heart disease, CHD, what happens is fatty material begins to build up inside. Okay, so it might start off quite minor, where you've got a little bit of fatty material and the blood's still able to go through quite easily. But over time, plaque can build up here. So kind of this can start to harden. More fat, more cholesterol can start to build up on this. And over time, what starts to happen is this coronary artery becomes blocked. So now if you imagine lots of blood trying to come through to the heart, it's not going to happen, right? It's not going to happen. And because of this plaque that builds up here, okay, so we have plaque, Plaque, and fatty deposits. Because of that plaque and fatty deposits, what actually happens is the blood vessels, the coronary arteries, also become less flexible. And because they're less flexible, when all of this blood starts trying to get through, it can cause the blood vessel to burst. Okay, so eventually this blood vessel can burst. And what do you guys think this causes when the blood vessel bursts? Yeah, death, right? You're going to bleed out very quickly. Okay, so what you might actually notice at the beginning, you might get a heart attack and so on. Atherosclerosis. So atherosclerosis is actually, it's a nice point you're making there. Atherosclerosis is a type of disease which causes you to have a greater likelihood of this happening over here. Okay, so not due to not eating well, but due to genetics. All right. Now, a couple of things that we should know is if these coronary arteries are partially blocked, it can cause something called angina. And angina is just pain. Okay, pain in chest. It's severe pain in the chest area. Okay, and this pain is there to tell you, so this angina, this pain is there to tell you that you have some quite blocked coronary arteries. Okay, and that's not great. If they are completely blocked, so complete blockage, okay, will equal to heart attack. So not only will the blood not be able to get through, but the heart cells will not be getting enough oxygen, so they're going to begin to die. Okay, if they can't aerobically respire, they can't produce energy, those cardiac muscle cells will begin to die. So then we need to think about, well, how do we treat CHD? Okay, we already said that it's caused by 1, obesity, 2, genetic factors, 3, smoking, drinking alcohol, things that increase the amount of fat staying within our body. Okay, very good. I'm seeing some good answers. So how do we treat CHD? There's a couple of ways, right? I can see somebody's already said statins and somebody's already said stents. And those are very good options. So what can we do? We can take statins. Now, what do statins do? Statins lower the amount of bad cholesterol that we have inside the body. Okay, there's 2 types of cholesterol. We have something called LDL and we have HDL cholesterol. LDL is low density lipoprotein. You don't need to remember that. HDL is high density lipoprotein. Again, you don't need to remember that. The LDL is the one that I remember is the bad one because you want to keep low levels of it. And then HDL is the good cholesterol because you want to keep high levels of it. Okay, and there is such thing as good and bad cholesterol. The LDL is the bad cholesterol. The HDL is the good one. Okay, now, what statins do is statins increase the levels of HDL, of the good cholesterol, and they lower levels of LDL. So they lower your bad cholesterol. Okay, and by doing that, actually what the HDL does is the HDL lowers your LDL levels, okay? Your HDL is able to turn LDL into HDL. And by lowering the LDL, that's going to decrease this. By increasing the HDL, that's going to further decrease this. So the levels of your bad cholesterol will overall keep going down. And that's kind of the main idea behind statins. Can anyone tell me what the disadvantage of statins is? Why are statins not great as a solution to cardiovascular disease? Yeah, this is where we learn about stents too. Can anyone tell me why are statins not a very good long-term solution? Have to eat every day. Yeah, you have to take them every day. Yeah, you might get side effects. Yeah, joint pain, things like that. You have to remember to take them, absolutely. And there's actually been cases where people who take statins for a long period of time end up getting liver damage. Okay, liver damage, kidney damage, and so on. So long-term use of statins is not actually really great for your other organs. So you'll be helping your heart and your coronary arteries, but at the same time, you'll be messing up your other organs, which are also very important. So it's kind of counterintuitive, isn't it? Okay. Now, the advantage is, well, you're going to lower your bad cholesterol levels and therefore you'll reduce the amount of blockage in your arteries. And that's fantastic because then your heart can work for a little longer, right? So generally statins are given when someone's preparing for their heart transplant or coronary artery transplant or something to that effect. Okay. So we said statins are one way. The other one was stents. And stents are simply a way of opening up this blockage. Okay, so it's a way of inserting a fine wire mesh into this blocked area and pushing against the walls there. And by pushing against those walls there, we're able to kind of crush that fatty layer against the walls and therefore open up the lumen. Okay, and open up that blockage. So stents are actually very effective. But the only problem is there's a risk of blood clots, okay, because your body's naturally going to be telling your blood cells to clot there, because it's going to be saying, wait a second, there's something there. We should probably try to clot it, because there seems to be some sort of problem there when it sees the stent. And then it's kind of counterintuitive again, your body fighting against your solution to the blocked arteries. And yeah, very good. Somebody said that you've got to take anticoagulants. So anticoagulants are to stop the clotting. And it's a surgical procedure. So like you guys say, there's always a risk of infection and therefore a risk of death. Right? So then we can talk about heart transplants. Okay? Heart transplants are arguably probably the best solution to this, even though stents can last a long time. There's still an associated risk of death here, but I guess a little bit less than normal, right? Yeah, absolutely, Sienna. There's always going to be a risk of rejection, isn't there? Always going to be a risk of rejection. So let's have a look. Transplant. Let's see. Disadvantage of heart transplant is rejection. Yep. It can gather again and then you'll have to get a new one. Yep, absolutely. Very good. Let's see. Another disadvantage. This adds, so risk of rejection. Risk of rejection. Risk of infection. Yeah. I would also say long waiting list, right? Unbelievably long waiting list. So it would probably take a very long time if you did need a heart. Anything else that you guys can think of? I think that's probably pretty much it in terms of disadvantages, but you guys might be able to think of some more. Yeah, you've got to take anti-rejection meds. Yeah, blood loss. So there's always risk of death during surgery, right? That's just normal. So yeah, very good. Pros, I mean, you're not going to need to take statins. You're not going to need to take stents. Your heart's going to work, hopefully. You get to live a little bit longer. It's a long-term solution rather than a short-term solution. Yeah, finding suitable person, same as long waiting list here. But yeah, suitable person is also very important. Otherwise, the risk of rejection is quite high. Yeah. Longer quality of life. Expensive, yeah. Although we've got the NHS here. Ethical issues, perhaps. Yeah, really good points there. Very, very nice, guys. So you guys have done really well here. You guys have all had really good ideas. And really, really nice interaction. So thank you guys for interacting. Like I told you guys earlier, this is going to go up on my YouTube. So if you have missed anything and you want to check it out, as well as part 1, which was looking at the heart in more detail and the pathway of blood through the heart and so on, you can check out tutor.chris on YouTube. Let's see, has anyone found it? Yeah, some of you have added yourself onto my subscriber list, and you can check out all the previous lives here as well. So make sure you do that. And for those of you who are here for the first time, make sure you're following. I can see some of you are already following, so thank you for the follows. And make sure you check out those predicted papers on my website. Like I told you guys earlier, these are going to be the closest that you're going to get to the real exams. They're going to be really good sources of revision for you, so make sure you check them out and use the code LIVE30 on my website so that you get 30% off already all the already heavily discounted papers. Yes, I will be on the live tomorrow, so you guys will see me back again tomorrow, and we're going to do another topic. Yes, the heart topic is likely to come up, as always. But yeah, very well done again today, guys, and I will see you guys very soon. Make sure you check out my website. Make sure you check out my YouTube. Make sure you get yourself these papers, and don't forget to use the code LIVE30. And make sure you're following. Tomorrow it will probably be around 5 p.m. Yeah, absolutely. Very common. What time tomorrow? Like I said, around 5 p.m. tomorrow, UK time. All right, guys. See you guys in a bit. Have a nice rest of your evening and have a good week at school. See you in a bit, guys. You're welcome. Real Fusion, you joined right at the end. Yeah, it will be on my YouTube though, Real Fusion. Check out my YouTube. Yeah, they love repeating questions. See you guys in a bit. You're welcome.